The psoas muscle is one of the main stabilizers of the lumbar spine. It originates from the transverse processes of all lumbar vertebrae, and it's the only muscle in the spine that its second attachment point is the femur. There is no other muscle that starts in the spine and attaches to the leg, to the femur. The antagonist of this muscle is the gluteus muscle. That is, these two muscles, they are antagonists to each other. When the gluteus muscle is strained, at this moment the psoas muscle should relax. When the psoas muscle is strained, when the leg goes forward, at this moment the gluteus muscle should relax. When the gluteus muscle contracts, it pulls the leg back. That is, the femur makes such a movement. When the psoas muscle contracts, it moves the leg forward of the femur. And the step itself turns out to be a sequence of the work of the gluteal muscle and the psoas muscle. It often happens that the gluteal muscle is weak, and the psoas muscle becomes short. In this case, leg retraction movement is limited. When the psoas muscle is shortened, the short psoas muscle does not allow the leg to retract. Also in this case, there is a change in the position of the pelvis. These two muscles, the gluteus and the psoas, they must balance the pelvis itself, its position. With the weakness of the gluteus muscle, which with its tone does not allow the pelvis to rotate forward, when the gluteus muscle is weak, the pelvis rotates forward. With the weakness of the psoas muscle, while maintaining the tone in the gluteus muscle, which is very rare, on the contrary, the pelvis rotates backward, or it arises on the opposite side from the weak gluteus muscle. That is, let's say, our gluteus muscle is weak. At the same time, the stabilization of the pelvis itself is disturbed, and it begins to rotate forward in such a way. So in this way, the pelvis begins to rotate forward, and at this moment, the psoas muscle shortens. That is, the tilt and rotation of the pelvis forward is caused by the weakness of the gluteus muscle and the shortening of the psoas muscle. To correct this disorder, the gluteus muscle needs to be toned, and the shortening of the psoas muscle needs to be eliminated. There are also often cases when the psoas muscle on the right and left has a different tone. Usually, for example, one of the psoas muscles stops working. The cause of this could be nerve compression, which innervates this muscle. Subluxation in the joint of any of the lumbar vertebrae to which the psoas muscle is attached, or compression of the psoas muscle's tendon due to the weakness of the middle gluteal muscle. That is, due to problems with the sacroiliac joint, this muscle stops working. And in this case, the other muscle first shortens, and then gradually hypertrophy of this muscle occurs, and the other muscle atrophies. And in this case, the position of the lumbar vertebrae changes due to the fact that the stronger muscle will shift them to its side. In addition to them shifting, there will also be a rotation, that's torsion. This is clearly visible on their X-ray images. It is precisely the different tone of the psoas muscles. It is most often the cause of scoliosis in the lumbar section of the spine. In addition to this, there will also be asymmetry of the pelvis here. Another disorder that may be associated with the psoas muscle is the pinching of the sciatic nerve. When hypertrophy occurs for some reason in the psoas muscle, it can either be a weakness of the gluteal muscle, when the psoas muscle will increase as its antagonist, or a weakness of the lumbar muscle on the opposite side, or simply a person incorrectly does the exercise on the press, when instead of the abdominal muscles, the psoas muscles work, and it increases in volume, then under the inguinal ligament, Where this muscle passes next to the sciatic nerve, increasing, it begins to pinch the sciatic nerve. In this case, there is a disruption of the innervation of the quadriceps muscle of the thigh. This powerful quadriceps muscle of the thigh, the nerve is squeezed, the conduction of the impulse is disrupted, and gradually the quadriceps muscle of the thigh becomes smaller, smaller, smaller in volume. Also, in some cases, with sufficiently strong atrophy of the psoas muscle, kidney instability occurs. That is, nephroptosis occurs, but it is usually not strong, somewhere at the first degree. And in this case, when a person is lying down, the kidney is in its place, and when a person stands up, it drops somewhere within 3 centimeters, changing its position. This is associated with an insufficient volume and a lack of tone of the psoas muscle. And just like the fat capsule around the kidney, it also forms the kidney bed. And with a decrease in its volume, the kidney just starts to bolt back and forth. In some cases, such disorders occur. That's what we were talking about, how it all happens during the step. During the movement, during the push of the back foot forward, the gluteal muscle should tense. That is, it should work at this moment, and at this moment, the psoas muscle should stretch. If the psoas muscle is not long enough, it will prevent the gluteal muscle from working fully. Because for its inclusion, the pelvis must remain in place, and the gluteal muscle should tense at this moment. With a shortened psoas muscle, it will happen so that the pelvis will also change its position along with it. The thigh. This should not happen. The pelvis should stay in place, and the thigh should go back. In this case, the gluteal muscle will work to the maximum, and the psoas muscle will stretch. One of the exercises, with the help of which you can stretch the psoas muscle, put one foot forward, the other back, the toe looks at 45 degrees. You turn the pelvis so that it is in the frontal plane. Put your hand on the buttock from the side of the back leg, shift the weight of the body forward, straighten up and push the pelvis forward and down. In this case, you will feel the stretch here, more in the hip joint area. This is exactly where you will feel the stretch in this part of the psoas muscle. That is, this is what it will look like from the front. Put one foot forward, the other back, the heel is looking at 45 degrees, you turn the pelvis and push down on the buttock with your hand, pushing forward and down. This is how you stretch the psoas muscle. This needs to be done so that the gluteal muscle can fully engage during the step. But definitely this exercise needs to be combined with strengthening the large gluteal muscle, which we will talk about next time.